Hello, I'm Dr. Kris Kowdley. I'm director at Liver Institute Northwest and professor at Elson S. Floyd College of Medicine at Washington State University. Today, I'm delighted to be joined by Janine Mion, a patient with PBC, primary biliary cholangitis, and also a patient advocate who has kindly agreed to discuss her experience living with PBC. Welcome, Janine.
Thank you.
Can you start by telling us a little bit about what led to your diagnosis, specifically if you had any specific symptoms that led you to seek medical care?
I guess I'm one of the lucky ones because it was a short route. I began not feeling well in the month of September. I was working and I had my own business on the side. My job was very stressful, I was on call all the time. And all of a sudden, it used to be on the weekends, I would sleep and catch up and I'd be fine, but I couldn't catch up anymore. And then I started itching. So I went to my GP and he ran tests and noticed that the liver enzymes were up. And he sent me to an internist and they did the AMA and I was positive. And in January, they did a biopsy and I was diagnosed in January. So it was only a few months, which I know from other people that they've gone through months and months. So I was very lucky.
And then at that point, did you get referred to a GI specialist or directly to a liver specialist, or did the internists themselves start you on, treatment and counseling about PBC?
I stayed with the internist. I was living overseas at the time, so the medical system is a little different. It took a long time and a lot of different things to try to get the numbers down. It took, I think, like 8 years before things like my outcosts went to normal, and I've stayed that way ever since.
Well, that's fantastic. And I think you already alluded to how these symptoms impact your daily life in terms of your inability to rest.
Yeah, I tried for a year after diagnosis to work, but I couldn't make it through a day. And still to this day, every day from 2 to 4, I am napping because otherwise I would be asleep by like 7:30, 8 o'clock. And when I was still working, there's no time for anything else. You get up, you go to work, you come home, you go to sleep because you have to rest for the next day. And there was no social life, anything like that. That all gets put aside because I had to work and I had to do my job.
How about other things like, leisure activities, hobbies, time with friends, things like that? Did you just sort of give that up?
Yeah, I kind of withdrew because you don't have the time. And then people ask questions. And if you're one of the people with the itch and you're sitting there in public going like this, people look at it's just easier just to stay home. And it's just easier to do that rather than to go out, to have to explain, to have to say, okay, now I have to leave because I'm really tired, even though I've only been out for like 2 hours. So it makes a big difference.
With regard to sort of the diagnosis of having liver disease, did you feel like that's something that was embarrassing or a little stigmatizing for you, or is that something you didn't experience?
No, I did because again, this was 20 years ago when I was diagnosed. Yes, people think that, especially when the name was cirrhosis, and that's a big reason why we changed the name. We fought to change the name because people hear cirrhosis and they think you've been drinking.
Right. I think that's an issue, and I think the point you make about the name change of primary biliary cirrhosis to primary biliary cholangitis is really important. Now, in terms of your symptoms, have you needed to try multiple different strategies or different types of management approaches to try to find relief of these symptoms? And do you feel like that's improved over time?
The fatigue, there's nothing really out there that I know that helps that. The itching, I do have a little concoction of different meds that I've been using for the last couple of years, and it's really helped. I have breakthrough itching every once in a while, and I have my handy bag of peas in the freezer to put on it to keep them so I don't scratch. But I've been lucky with that the meds that I'm taking are working.
Yeah, no, that's great. As we wrap up, do you have any additional information or suggestions or feedback that you wish other healthcare providers should be aware of?
Support groups are a big thing. When I went to my first conference, I walked in and I was like, look at all these people. And they're walking around and they're talking and they're laughing and they have the same thing as I do and they're still going. And to meet people that have the same thing as you, that's going through the same thing you are, that was a godsend. That was the best thing I could have done, was go to that first conference. And now I'm involved with the organization, and it really helps to talk to somebody who knows.
Yeah, I think that's great advice. And I want to thank you for sharing your time with us and your perspective and your willingness to help others in this journey. Your perspective has been really insightful and helpful. And we hope that healthcare professionals who are listening would better understand the patients we treat and be also empowered to be proactive in managing both symptoms as well as the disease. So thank you.
Thank you too.